And it's not that there's a mean-spiritedness in the law in Canada. It's not about that. It's about what is available, what government can afford to give out to everyone in Canada. And there's nothing driving anyone in Canada to invest in a new MRI machine and the latest equipment. There's, in fact, what the incentive is in Canada, I came away with a real strong sense that the incentive is to consume as little health care as possible, because a clinic and a hospital is given a certain amount of resource from the government to work with over the course of a year. They have to stretch that a year. Obviously, it can only be consumed by a certain number of patients at a certain rate, whereas in the United States, we have clinics and with MRIs that advertise, such as Rocky Mountain Cancer Centers and others like that. They are trying to maximize the number of patients coming through the door. We have such an abundance in the United States of great MRI equipment and CT scan equipment that about a day before I went off to Canada to this conference, there was a gorilla at the zoo, at the Cheyenne Mountain Zoo in Colorado Springs, who had a headache. And Rocky Mountain Cancer Centers heard about it, some other doctors heard about it. They had enough resources that they were able and willing to donate their time and resources to give the gorilla a mobile CAT scan. And then he got surgery on his ear by an ear, nose, and throat specialist. And
so in other words, apes in the United States get better, faster care than mothers like Lynn Gilbert. Now,
in some cases, I think that is correct.
Lynn Gilbert's not some 90-year-old woman who Obama says, you know, maybe she's better off with the pain medications. This was a young mother.
Who became, by the way, and she didn't say that there, addicted to morphine, and it took her 2 years to kick the morphine habit because she was on painkillers.
That was one thing that every single patient that we met seemed to agree on, that morphine was given away like M&Ms.
Like candy.
Like candy.
Yeah,
anything to
amazing.
shut people up so they, you know.
Why?
It's cheap. I mean, one thing that people don't understand, you get a lot of people running around the United States saying the problem is profit in medicine. But profit in medicine does two things. It encourages people to work very hard and do a lot of procedures. And second, it encourages people to minimize costs. There's no reason to minimize costs. Canada has a very expensive healthcare system. What they don't include is how long she waited. 4 years of lost wages for her. 4 years of disability payments. If you include the waiting list, Canadian care is far more expensive than U.S. care.
How do you keep her quiet? How do you keep her from making a lot of noise about this? That's where the cheap morphine comes in. And as far as prices, I think Dr. Keith Smith is a great example of how competition in the United States, if clinics are allowed to compete and hospitals are allowed to compete, which they're not allowed to in a lot of states because of various regulations. But in Oklahoma, he's been able to start a clinic. He advertises his prices online. And
if his procedure costs more than what is stated online on his menu, he has to eat that.
He absorbs it.
And opposite of the Canadian system, he makes money by getting people in the door and out the door, whereas in Canada, they have to hoard their money and make sure that they keep folks like Lynn Gilbert out until they can cover as many people.
And in fact, when the tour director up in Canada calls Dr. Keith Smith and says, I have a patient who needs a disc fusion, and right away I'm bidding it around, I have a quote from Montana at this price, Dr. Keith Smith is likely to try to bring that cost down. So you know, they're getting a whole different experience in the United States. Now, not everyone in the United States has that experience because they're not paying for it out of pocket. There's a third-party payer. But that's the way it can be in the United States if customers are allowed to pursue medicine and have some say in what it costs.
We're great consumers, but when it comes to healthcare, we don't buy our own.
We're ridiculous.
Let me get back to Lynn Gilbert for a second. I mean, the point you brought up was amazing, that she lost her job because of her back pain. She was then put on disability. She was given diapers and a cane and a walker, but not the surgery. And for years, they had to pay for that. They had to pay for her morphine. Then they had to pay to get her off of morphine, which took a couple of years. Now she's employed. Matter of fact,
she has her own business.
She has her own business, and she hires over a dozen people herself. They could have had all those people working before, if they gave her the surgery early. Why is it that in Canada they would look at somebody like Lynn Gilbert and go, you haven't suffered enough. I tell you what, there are other people in line. It makes sense for us to have you wait this way and not be able to pick up your kids.
Well, from my perspective, it's because if you have a nonprofit system where the government is budgeting everything, patients are just a cost. They're not an opportunity for anybody. They're just a cost.
Right.
Nobody has to think about the opportunity cost of her sitting there. And so if you have a non-government run system like we still have mostly in the U.S., patients are an opportunity. Everybody wants to get them back to work as fast as possible. They want to get back to work. Their employers want them back at work. Their insurers want to get them fixed up so they can go back to work.
It's a waiting queue.
Yeah.
Look, you've got a waiting queue that they put her in, that they had to put her in because there was more demand than there was supply. That's what we're going to run into in the United States as government gets more involved in healthcare rather than less. In the United States, when you have a waiting queue, what that is an opportunity for somebody like a Dr. Keith Smith to say, hey, I can get some of those people out of the queue and make money doing that, giving them good service at a low price. We don't have that entirely in the United States. In some places we do, in some isolated places. We have too many states where the legislature won't allow you to just open up a clinic.
Because the hospitals act as a cartel, and
Right.
they have regulations passed that keep competition from shoving
So what
prices down.
Republicans could have been doing all along during this whole health care debate was trying to find a health care package that mostly revolved around deregulation, things that already exist in our current health system that impede people like Dr. Keith Smith from doing what he does.
One of my colleagues up in Canada has a bad back as I do. My doctor finally said, well, all right, we tried this, we tried that, just go get an MRI. And I asked, well, where do I do that? He said, oh, there's like 3 places here in Boulder to do it. We like this place. I called them. I had an MRI the next day. New open face MRI, new machine, walked out with a DVD of my back. My colleague up in Canada had the exact same problem. Doctor said, well, you got to go get an MRI. He said, well, how long will that take? He said, currently, the wait is 52 weeks. And he said, well, was there any way to push it forward? And the guy said, well, if you see a specialist, they can move it forward. And he said, well, how do I see a specialist? And he said, well, you can't see a specialist until you get your MRI.
Right.
And that catch-22, and so what did he do? He paid for his own MRI and was able to get it next week.
And you can't do that in Canada. That's another thing. Canadian law prohibits doctors from selling health care. You can't jump queue just because you have money in Canada. You can't say yeah.
But you can come here.
You can come here.
And what I was going to make the point was, Lynn Gilbert was a poor student when this happened to her. She had no other alternative except to put up with the Canadian system. The wealthy people are like, well, we love all this equality, but if they really get in a jam, they can go elsewhere and pay cash for care.
And
so
now,
it really dispossesses the poor. People have no idea.
And now that Lynn Gilbert has a son that's
got the same condition,
having the same condition, what is she doing? She's saving her pennies because she's not going to let what happened to her happen to her kid, and she's already arranged for treatment down here.
And what we saw too, these were not just rich Canadians who we met with up there, obviously, as you just pointed out. To save your life or to save the life of one loved one, you will part with a house. You will part with a lot of your possessions to come down here and get a procedure done. And, you know, that's something...
Don't worry. Just as they were able to move south, if Obamacare comes, we'll be able to go down to Mexico for these surgeries.
There you go.
There you go. Say what? Why don't we meet one more patient? I think this is an interesting lady. Cheryl Baxter is a woman who needed a hip replacement. She had to wait and wait and wait. Let's hear her story. This is Cheryl Baxter.